Hello. Could you please tell us your name and something about you?
My name is Judith Tintinalli, and I'm from originally the Detroit area, from the state of Michigan. I set up 2 ER residency programs in Michigan, one at Wayne State University, one at Beaumont Hospital, which is a private, very large community hospital, maybe secondary, tertiary care, and then went to North Carolina to set up the Department of Emergency Medicine there, and as a new department came as their chair. So I was sort of looking to continual academic or professional progression in my life. At the University of North Carolina, I guess I would say it's my favorite hospital. It's kind of a mixture of all different kinds of patients. It's a state hospital, so you see patients from the city. Their next patient might be the dean, it might be your professor. You see poor people, you see people coming from all over the state who are coming for our tertiary care, so I like it a lot. I also have appointments in health policy, where I help do a seminar every year to graduate students in health policy and management, because they are very interested in emergency medicine and how we work efficiently. I'm also a faculty member in the School of Journalism and Mass Communications. So I have a sort of seminar where we sponsor graduate students in journalism who come shadow different people in the ED, and then they write articles about that as part of their coursework. Well, my whole idea for that is because I think the news media needs to know what emergency medicine is, and every person that we teach about ER will help spread our message.
What brought you here to Lithuania?
Well, I was invited by Dinas. I had met Dinas in Poland at several meetings, and I had heard him speak and tell me about the emergency department that had been set up here, about the medical school and the university, the quality of the residents, and the kind of curriculum that was done. And I thought, wow, that's really good. It's really starting off at the top. I've been to all the Baltic countries except for Latvia and Lithuania. So this was a good time to see this enchanted land. It is enchanted.
As an elder in our emergency medicine, as a say matriarch creating this specialty, what do you think personal qualities does it take to be a good leader in ER?
The first is to not be afraid to accept challenges. A lot of the things that I did, I hadn't exactly set my mind to it, but there was an opportunity, somebody needed somebody to chair a committee. Writing the book started that way. Do you know there was an ad in the Annals of Emergency Medicine looking for somebody to put together information so that physicians knew what to study for the emergency medicine board exams. So I thought, I don't know, maybe I can do that. I was the only person who actually answered the ad, so I did get the job. But sort of stepping in where you see a vacuum, where you see something needs to be done, those are the kinds of things that start you off as a leader. Then you need enthusiasm, you need the energy to gather other people around you, and then the final thing is you need the persistence, because nothing is going to happen overnight. So you have to keep in mind all the tasks that you have, and you have to make sure that you do them, because you're not going to get anywhere as a leader if you talk, but don't get anything done. So I suppose I look for the same qualities in emergency medicine residents, but the one thing that makes me excited about getting a person in the residency program is having an interest and an open mind to what's going on. To be working on a shift and ask, well, how come we're doing it this way? Or to say, Dr. T, what do you think I should do here? And I say to them, well, what do you think you should do to take care of this patient? Or if they ask me a question and I don't know the answer, together we have the intellectual curiosity to really keep moving on. So I'd say intellectual curiosity, energy, the ability to work well and organize yourself in the ED, and to really like the specialty. I don't think there's any one thing you can say, except you would say when you walk into the ER, I like it here. And that is what makes people go into ER.
Do you remember your first shift while working in ER? Your first day?
Well, you know, I remember as a medical student, I remember that vividly. So we'll count that my first shift, because I was assigned actually to the trauma area. I guess I was at the US, I was a third-year medical student. So we have 4 years of medical school. So it was pretty junior, and there were all kinds of trauma. And I saw this young guy with what turned out to be an Achilles tendon laceration. And the chief surgery resident was walking around trying to manage gunshot wounds and stabs and everything. And he's like, sew it up. I'm like, how? It literally was through the Achilles tendon. So he showed me how to do a figure of 8 laceration, and he said, just do suturing and wash it out good and sew it up. I'm like, oh my God. And he said, oh, and then put a splint on. Well, it turned out that man was a man named Ronald Crome, who was one of maybe the big 5 people who had started emergency medicine. He was still a surgical resident, but it's kind of serendipity that he's the man who told me what to do for that particular patient. And I'm like, God, I can do this. And I like the variety. I remember that the most as a student.
This year, our residency celebrates 5-year anniversary. Also, this year we have our first certified ER doctors. What advice would you give them, or you could wish them something?
Well, I wish you happiness and satisfaction in your career. That is for sure. And I think if you've been in the program for 5 years, you're well positioned. You know that you're going to like it. And what I usually tell my residents is we talk about the first year or 2 out. Well, what kind of a job will you get? Because everybody wants to just get their feet wet and see what it's like to practice outside of a teaching environment. Or if you're going to stay in a teaching environment, the roles are reversed, and now you've got to practice teaching everybody what you spend time learning. So you can do that for a short time, a couple of years, but then after that, I like to challenge residents or young faculty to look at 5-year blocks, because 5 years goes by very, very quickly. And you've got to start thinking, 5 years, okay, I'm going to do this for 5 years. I don't know how old you guys are, but and the women are. But if you don't start thinking about it, then another 5 years will go by. You'll have families, you'll have a bunch of children, and you'll have other responsibilities that suddenly it's no longer you who are the primary person. It's other people you're responsible for. So you have to start thinking about that and what your goals are. Many people are very satisfied with working day to day in the ED with no administrative responsibility, doing your best job on your shift, ending your shift, going home, hopefully having a clear mind, not worried about the patients that you might have done something different on. So there are many, many like that. And that there's nothing wrong with that at all. But you need that time to figure out if that's the kind of ER doctor you want to be. Usually, the first graduates have a lot more in mind than just working in the ED. So you should start thinking, well, do I need an advanced degree? Do I need a doctorate in something? Do I need a master's in public health? What's all this stuff about money? Maybe I need an MBA. Maybe I should study economics, although that's sort of a theoretical thing. But do I want to get involved in hospital administration? Start offering yourself to participate in hospital committees. Do I want to get involved in the National Lithuanian Emergency Medicine Group? Our emergency medicine groups around the world are very open to young people, because that's our blood, that's our future of the specialty, and I look upon you guys as my future. So you need to start thinking about that and make little steps. We do know that the highest degree of satisfaction in emergency medicine comes from participating a little bit beyond doing clinical work. So it might be teaching nurses, it might be writing policies for the department, it could be something small, or it could be something big. But adding that on sort of gives you a more diverse career. Also, you're going to only think in 5-year blocks at this point in time, but at a certain point in time you're going to hit mid-career. And then you have to start thinking, what now about the next 10 years? But right now, for all of you, think of the first year, getting your feet wet. After that, 5-year blocks of time.
Professor Tintinalli, thank you very much.
Okay, you're welcome. Oh.
Can you please present yourself?
Hi, I'm Jim Holliman. I am a professor of emergency medicine and public health sciences at the Pennsylvania State University in Hershey, Pennsylvania in the U.S. And I'm also professor of military and emergency medicine at the Uniformed Services University in Bethesda, Maryland, which is the U.S. Military Medical School. And here at the conference, I'm also representing the International Federation for Emergency Medicine as its immediate past president.
So what brought you here?
Well, my whole career has been centered around the development of emergency medicine in other countries. And I was invited to speak at this conference, and I am so excited and so happy to be here to see the success of early emergency medicine here in Lithuania and to celebrate the graduation of the first class of emergency medicine residents. And just a few minutes ago, we found out that these residents all passed their European board exam in emergency medicine. So now we have something else to celebrate. And in addition, my wife's family is originally from Lithuania. So we were most happy to be able to see the villages where her family came from before they came to the United States.
Can you tell some motivation? Why should they choose emergency medicine instead? Why should they choose this horizontal, not vertical residential?
Well, I would very much encourage all the medical students here in Lithuania to consider a career in the specialty of emergency medicine. It's actually the most popular choice for medical students in the United States. And I think it can be an extremely rewarding career. And it has a lot of different aspects to the career in emergency medicine. It can, of course, be involved in clinical care of patients in the emergency department, but also be involved in pre-hospital care, in administration, in teaching, in research, in interacting with other specialties, in helping develop the specialty in other countries. As an example, the specialty is so successful here that some of the graduates of emergency medicine residencies here in Lithuania might consider trying to help develop the specialty in some of the other ex-Soviet countries that don't have the specialty, including Russia, as well as the Central Asian republics that don't have this specialty yet. So there's huge opportunity also for international development and international research projects in emergency medicine. So I think it's a wonderful career, and I would very much encourage the medical students here in Lithuania to consider applying to the emergency medicine residencies.
So the question about residency is the mentorship. We in Lithuania don't have our traditions yet, and we decided that our senior residents will be the mentors of the fourth-year residents, and so on. Like it's like a tree structure. But sometimes we feel that we lack some tradition and idea what to do, and can you give us some advice of your career?
Well, I want to compliment the early classes of residents here because they're very brave people, I think, to go into a brand new specialty. And as you say, they don't really have any faculty mentors. And the system you have started of having the seniors be mentors for the juniors, I think, is a very good one. But then I think as the residents graduate, they should take on the role, a continued role, to be mentors to the more junior people. But then I would certainly offer myself and my other colleagues here from other countries who have experience in emergency medicine, we would certainly be glad at any time to provide some advice or mentorship to the residents and students here.
Okay, thank you very much. We hear that. So how do you stay healthy in emergency department?
Well, now that I am way past the age of 60, I am no longer required to work overnight shifts. So I have that makes my life a little bit easier in my older age. But I think it's important too that emergency medicine is physically demanding. And so I think an important thing to recommend to the students and residents is that they should try and stay in good physical shape, because that makes the work much easier and less stressful. And then to also emphasize that it's important to have a good life outside of the hospital. And I encourage people to develop, we say, hobbies or interests. I recommend to residents that they have at least one hobby they can enjoy inside buildings when the weather's bad outside, and one outdoor hobby they can enjoy when the weather is good outside.
And the question about military medicine, you told that you are related to military medicine. Maybe there is a possibility of our new emergency medicine doctors to join this field.
Yes, one thing I would like to potentially offer is what we call Operation Bushmaster. I'm one of the senior faculty for that. That's a field exercise for the military medical students from the Uniformed Services University. And what we do is take the fourth-year medical students and public health students, and we divide them into platoons, and they simulate the operation of field hospitals in a simulated combat environment. And then we take the first-year military medical students, and they role play as sick call cases or combat casualties. And then as faculty, we try and teach the fourth-year students how to take care of the simulated cases from the first-year students in the combat and field environment, which is completely different than how they're taught to manage cases in the hospital. And this exercise is open to students from other countries. So currently we have students come from Britain, France, Germany, Israel, Japan, and Mexico. And we would very much like to have some students from Lithuania come to the event. And I think they would get a lot out of it.
Students or residents can join?
Residents could potentially also come to this exercise, right? Both potentially as participants, but certainly at least as observers. The event is held in October of each year at a National Guard training facility near where I live in Pennsylvania.
Can you wish something for these new emergency medicine doctors here in Lithuania? How to become, how to achieve their goals and how to be a good specialist?
Well, my main, I guess, wish would be just for the continued success of both the specialty of emergency medicine and for the success of all the graduating residents in the programs here. In terms of how to maintain that, the main way, I guess, would be just to continue to do a lot of hard work, but also to develop leadership, and that I think all the graduating residents are in a natural position of becoming a strong leader. And some of the residents might want to undertake additional post-residency training in subspecialties. The one that I'm the most involved in, of course, is international emergency medicine, but there are quite a number of other fields for the residents to consider. For instance, they could do a fellowship in ultrasound and then become the expert ultrasound trainer for one of the major medical centers. Or they might decide they want to specialize in pediatric emergency medicine, and then they could do a pediatric emergency medicine fellowship after residency. So one thing for the residents to consider is subspecialty certification and involvement in more leadership roles.
Okay, thank you very much. Thank you.
You're most welcome.